Hello, 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 and welcome to Lipedema Wellness Conversations with Gail. That would be me. And our friends. My friend tonight is Adie MacKenzie, and I'll introduce her here. Hi, Adie, in a few moments. But first of all, I want to welcome all of our members of our community who are watching me tonight, watching us tonight. Um, I missed last week. I was on a cruise. Poor me. Somebody had to go on vacation, and I raised my hand as fast as I could. So I am happy to be back here tonight to talk to all of you. Also, I just want to let you know there might be a time when the video freezes or possibly we cut out. I am having internet problems tonight, so please bear with us if you don't understand some of the things we're saying due to internet issues. So I do want to, oh my gosh, Adie MacKenzie. Adie MacKenzie is a CLT, certified lymphatic therapist. She has her puppy dog with her, and she's a coach here for Lipedema Simplified. And I am so happy to have her here with us today. Adie, what do you have to say for yourself?
Well, I'm happy to be here. I'm happy I made it home through the traffic. Nashville has really come into the world of being a high traffic city, and it was not cooperating very well with me today. But I got home and I'm sitting on my back porch, and it's gorgeous out here. And I have my friend Lulu with me in case you see a little fuzzy black face stick her head in the middle of this conversation.
Let's see her. Let's see Lulu. Let's see who you
Lulu,
have there with you.
let's see if she'll cooperate. She might not because she's very bossy. Come here. Come here. Come here. Say hi. I don't think she's
Oh.
gonna let you see how cute she is.
Well, but she knows how cute. She knows how cute she is. Oh, gives
She is
kisses.
pretty cute. She's been having hug sessions with a 2-year-old toddler in the neighborhood. When Lulu stands on her hind legs, and she likes to walk around like that. She's the same height as this little 2-year-old, and they hug each other.
Oh,
It's just
it's
unbelievable.
isn't it wonderful how pets and how animals can really like relieve stress and give
Yeah,
so much love and it's pretty unconditional, except they really love you when you have food. I do know that.
especially that. Yeah.
So, Adie is from Nashville, Tennessee, and she's been working with us for about a year and a half now with Lipedema Simplified as a coach and an advisor, pretty much. And I do know, Adie, that you have a couple of tremendous passions, um, tremendously powerful passions, and I know one of them happens to be the pneumatic pump, the
Yeah,
compression
yeah.
pump.
Yeah, I love tools that help us manage our lymphatic dysfunctions or whatever chronic conditions we're dealing with, in a way that's pleasant and positive and easy and improves our quality of life. And I think among the many things that we can do for ourselves, tools that do vibration or suction or all kinds of things, the massaging action of the pneumatic pump is just such a cool thing. I mean, even without, like, I don't have significant lymphatic dysfunction in my legs. I don't have lipedema, I have lymphedema. But I find that just wearing the leg compression pump garments is a great treat at the end of the day. So I'm very enthusiastic about them.
So you're telling me that even though you don't have lymphatic compromised, comprom- I guess that's compromisation. I don't know what exactly how to say it. You don't have compromised lymphatics in your legs.
Correct.
You love your pneumatic pump legs. You're getting
Mhm.
sliding into them. letting them give you a little massage. And
Yeah, yeah. I mean, at the end of the long day, everybody's veins are going to be a little challenged. Everybody's going to have. I mean, I don't know anybody who, at the end of a long day of being on their feet, and I'm a manual therapist. I'm a certified lymphedema therapist, and I work as a massage therapist in a medical clinic, and I'm on my feet all day long. And just at the end of the day, putting that thing on and taking a little break, reading a book, listening to something, watching a rerun of one of the sessions from our most recent Lipedema Simplified event. Doing those kinds of things, that's very soothing and relaxing. And at full
yeah,
disclosure, I work for a company called Eros. So we're one of the small pump manufacturers. We're not as large a company as some of the others that I know have been sponsors of our events, and that many of our members have. But we make really good stuff. And we just came out with the bilateral lower extremity up to the upper watershed. So basically the pants that come up toward our armpits.
I love
And
how you call it the upper watershed. Like I love that. I never knew what to call it. The upper watershed. It's like that's where the fluid comes through, right? Up into
well,
our
I'm actually probably verbalizing that a little bit incorrectly, and the CLTs out there are saying she's not saying that right. They talk about lines down the middle, and then across, and so the horizontal watershed is the one that comes across, basically at the level of your navel, the base of your ribs. And when we're trying to push fluid out of our legs, we want to get it above that line, into the upper quadrants, above the horizontal watershed.
okay.
So,
Okay. So because I do know that a lot of people have the compression pumps, and and the first thing that they're given is, or I shouldn't say given, but the first one they're prescribed,
mhm,
especially if they're depending on the company they're working with and what their insurance covers and whatnot, only goes up to the groin.
yeah, yeah,
And and that seems, for so many of us, it seems incomplete.
yes. I mean, for a variety of reasons. I definitely see patients. I've got a woman right now that I'm seeing where it's just her lower legs that are a problem. And it's because she's 92 and has had this amazing life and born 5 children and worked hard. And so her veins are failing. And she doesn't need anything to go all the way up above her navel. She's going to be
Right.
fine with something going above her knee. She's fine. If we have both of our legs involved and we've got some significant swelling in our abdomen too, then we really need to push that fluid up further and get it above the belly button to try to get it into that upper quadrant to help our
Right.
armpits kind of pick up some of that fluid.
So what about in the arms? So I know that many of us only have the pants, right? Or
Mm-hmm.
goes up past it goes up into the upper watershed, across that horizontal watershed. What about what about our arms? When we use pneumatic pumps on our arms, that's bringing it to this upper quadrant also, right?
Mm-hmm. Mm-hmm.
And does that also push it down into the belly? I mean, I guess I'm
So,
confused. I don't have a pump.
oh, you don't? Oh, we need to fix that. I mean, if you'd
No,
like.
I know we do need to fix that. I've been wanting one. Okay, go
I
ahead.
think they're pretty neat. But so, it kind of, there's a lot of, I don't want to go into full lymphatic anatomy right now, but if you've got lipedema in your legs and you've also got something going on with your arms, then you want to push the arm fluid into the trunk, but you don't want to push it back down toward your legs.
Okay.
So you could do the pants and you could do a vest. I'm not a fan of doing everything at the same time because I think our overloaded systems can only handle so much being pushed into the central part at one time. So if you're doing, both legs above the navel, I would do the arms at a different time. But yes, I mean, there are people who, I know that there's a company that makes, I don't, I say, I know, I believe that there's a company that makes something called a pod where your whole body's in it and getting squeezed.
Right.
Very curious to talk to people who've used that and hear how they like it, or if they notice any problems with it. But in our case, we have an arm garment that has a chest piece on it. So it won't just push it to the top of the arm, although
Right.
we do have that too.
Right.
But we do have it where it'll work the chest, because sometimes if we just go up to the top of the arm, it pushes into the breast. And that depends on
Right.
a number of factors.
So if I was looking to or thinking about getting a compression pump, who who do I go see about it? Because I doubt that my general practitioner would know much about compression pumps. So
Yeah.
who would I need to go see about getting one? Who can
So
prescribe one?
generally, what I see happen is that a CLT will notice that their client needs or will benefit from a pump. I don't know, you can say you need it, but you can't go see somebody for a massage every day, right? And you could use the pump every day. And some people really have a better quality of life if they do that. So typically a CLT will recommend it. They or you will communicate with your doctor to get a prescription for it. And then that will go to a DME, and it's a process. If you're going to get insurance coverage, if your CLT recommends a pump, sometimes you can buy one without going through your insurance, but they can be quite pricey.
Yeah. So you said a DME. What's a DME?
Thank you. It's a durable medical equipment company. So that's often the
Oh,
terminology for the place we buy our compression. Especially if we're getting custom compression, we're getting it from a DME, a durable medical equipment company.
okay. So then often we can start with our CLT
Mm-hmm.
or our massage therapist
If your massage
or
therapist is trained and knowledgeable about such things,
okay, physical therapist,
often, yeah.
often our physical therapist. Um, so then another question that we have out here that we need to address as we're
Yeah.
talking about it. Um, let's see, where did it go? It says right here. Um, does does the compression pump affect the heart?
So fluid can affect the heart. The pump isn't directly affecting the heart. But if we have pumping problems in our internal apparatus and we push too much fluid back into the system too fast, we can overwhelm the heart. So that's why it's a prescription product. You need your provider, whoever that is, the CLT, the massage therapist, the PTOT, to know your medical history and feel that the pump is appropriate for you and which pump is appropriate for you. And then to communicate with an MD or a nurse practitioner who can write the prescription. And
Okay,
so we take into account, does the person have kidney failure? Do they have congestive heart failure? Those things are not necessarily an absolute contraindication, but they are a relative contraindication. So they might mean that a person isn't appropriate to use the pump. Usually, if you're
right.
appropriate to receive manual lymphatic drainage from a therapist, then you're appropriate for a pump, but you want to make sure that it's being used properly at the proper settings and that you've got clinical guidance on it.
Okay, so when you talk about the proper settings, who who determines? It's okay, I know. I love it because you're outside and you finally got sunshine. So who determines the proper settings for the person, for the patient?
Generally, that's the CLT who will make those determinations. It might be the doctor, so each situation is going to be a little bit different. I will often communicate with my physicians and just ask them if they have particular feelings about the amount of compression the patient can tolerate. Usually they leave it up to me. Most of the machines have a standard setting that can be altered, but that standard setting is reasonably conservative, effective,
Okay.
but not a high setting.
Okay. So when when we're talking about um, when we're talking about pumping or using the pump, the benefits is to the first benefit is to get the fluid moving in the direction it needs to go. And I'm going to answer Cindy right now. CLT, Cindy, stands for Certified Lymphatic Therapist or Certified Lymph Therapist. However, I think people use different terms for lymph, but that's what it stands for. So when I say that Adie is a CLT, or Adie says, you need to talk to your CLT, it's your certified lymphatic therapist. So I was going to say now, besides just getting your fluid moving,
Yeah.
does the pump have any other benefits?
Getting the fluid moving has a lot of downstream benefits, right? So if we let the fluid hang around, and I'm going to just talk about what we typically see with lipedema. It's typically in the legs in particular. That fluid hanging around can become pro-inflammatory. It's lymphatic fluid is kind of part of our immune system. It's part of the way that our body gets rid of junk. So that fluid can be full of a lot of stuff that your body doesn't like and that creates irritation and can start to damage the vessels, damage the skin. So that's when lipedema can become lymphedema, because that fluid gets stuck and starts to create these changes, these fibrotic changes, which are not healthy for us. So the pump can help prevent fibrosis. It can help prevent, if we have limited mobility, using the pump can help prevent blood clots. But if we're already experiencing a blood clot, we don't want to use the pump during that time until it's been resolved.
Okay.
By keeping that fluid moving, it can prevent infections. So it's more, what it does is move the fluid and feel good. But moving the fluid has all kinds of other reasons that it's important.
Yeah. Now, my physical therapist is not necessarily treating me for lipedema.
Mm-hmm.
Um, she is treating me for some leg issues that I've been having, lack of mobility, those sorts of things, and she's helping me rebuild the strength of my legs. But she always says to me, "Hey, do you want me to wrap your legs today with you want me to do you want me to pump your legs today?" And she puts me in these leg wraps,
Mm-hmm.
and it's like from ankle to mid thigh, and they're chilled.
Oh, nice.
And I will tell you, I don't have a pump, so I have never had this pumping experience. She wraps me in these leg, these, a pump, and it's chilled. And I'll tell you, then she bundles my upper body up with a blankie,
Yeah.
and off they go with the pumping. My legs are elevated. She and I have already breathed deep, and we've rubbed my belly, and we've opened up all the, because she knows that, and she does manual lymph drainage for me and things like that. And then she wraps me in this beautiful legged pump. And
Yeah.
by having that done, I am now yearning to get a compression pump because
Well,
I'm
that
thinking, oh, this is going to feel great if I could do this every
yeah.
day.
Well, I want to respond to Susan because she's talking about that she has a hard time with the tactile pump,
Yes.
and I have heard other people say that, and I can't say that I've ever used it. I know that people tend to like the fill to fit style pumps. So the one that we have, the Eros, the Lymphopress, the Bios compression, and the Medi Brio. Those pumps all are fill to fit. So you put on a loose sleeve and then you push a button and it fills up and then it starts doing its thing rather than
Oh,
having to make it snug and stuff like that. So I would recommend one of those products, and of course, I love the Eros. Um, but Gail, I think that the pump you're describing is usually something that's for like after a joint replacement or something. And
yes.
I haven't experienced those, but I know a lot of people who love cold and who would love that. So I'll have to look into trying to experience one of those.
Yeah,
And
and she only puts me on it for like 15 minutes and it's like,
yeah,
"Woohoo, I'm happy," you know. So, but I've had a joint replacement and she's working and I think sports injuries sorts of things is what they use it for. You know, she's a physical therapist but
yeah,
I'll tell you, really makes me want to get my own pump. So,
I bet.
yeah.
I don't know how to respond to the comments. But I was gonna, if I could figure out how to do it, I was gonna put the names of those companies in the
Okay, well,
chat.
okay,
Can you do that?
I can do that. Um,
Oh,
so while we're doing that, we'll go back to some of the questions. I do want to welcome everyone here. So here's how you do it, 80. While I
yeah.
welcome everyone here, go into private chat and and just send me that message, and then I'll copy paste it.
Okay.
Okay, so while you're doing that, I want to let you know, everybody who's here tonight, while 80 is putting that into the chat that I can copy and paste, I want to say hi to Susan um, Cuevas and then Gamester TJ from California. Kristen's here from Northern California. Lynette is here from Alaska. Chris is here from Texas. Peggy, hi Peggy. I want to say Louisiana. I've known Peggy for quite a few years now. Mary's here from Milwaukee. Julie Rosa's here from Camarillo, California. Paige is from Tennessee also, which is cool because 80's from Tennessee. Eileen Navarro's here today. Cindy Tannehill's from Canada. Harriet's here from Charlotte, North Carolina. So we are from all over the place. Julie's here from North Carolina also. Deb's here from Massachusetts. Hello, everyone. I'm so glad to see you. And we're always happy that you're here. Let's see. Kimberly's here from Oregon. Alexis is here. I know Alexis. My gosh, we have a lot of people here today. Um, Kathy's from Montana. Kathy says, I just started with the pump last week for both legs, and it does feel great. I do the pump every night for an hour. My question is, would it hurt to do it more than once per day?
I, I think that's a question for the therapist that you work with. I like my people to be active if they're able to be active. So I'm not a huge fan of more than once a day, because you'd be better off doing something active during that extra hour. And I don't know you, so I don't know what your realities are and what that would mean to do it twice a day. So yes, some people do. Some people do an hour
Yeah.
in the morning, an hour at night. I'm not a huge fan of that, but that is appropriate for some people.
Yeah. So that's when you talk to your CLT or you make an appointment with Adie. And as you can see, I have Adie's email address, adie@lipedema-simplified.org across the bottom. Please feel free to send her an email at any time, and ask her questions. Just set up an appointment with her. Um, it's a virtual appointment. So Beth says, I really like the Arrows pump. The leg sleeves I have reach mid thigh. I see that they may have pants that cover up to the waist. Yeah,
Just
so that's
recently,
something
yeah.
you're talking. Yeah, just that's fairly new. Um, Now, Ara Lee is new to our tribe. She just joined our community. She says, I read that there is a medicine for lymphedema. Although I tend to avoid medicines. I'd like to know something more about it. Has anyone taken it? Um, for lymphedema or for lipedema, we right now everything's conservative treatments, correct, Adie?
So they are trying, there are clinical trials going on for medicines for lymphedema. They have some promising outcomes, but they are not released. It is not available on the market. I do not know if these medications will make it to market, but you can Google that. And I believe, I don't know if other institutions are doing the research, but Stanford, California, at Stanford in California, they are doing research on medications for lymphedema.
Okay, okay. Because I know that right now for lipedema, we are working with conservative treatments, and here at Lipedema Simplified, we do focus on the conservative treatments because that's something that we can do today. That's something we can each do for ourselves, self-care. Many of us are not either eligible or good candidates for surgery, or surgery just isn't in our future, or until surgery, we need to make sure that we're taking good care of ourselves. And then after surgery, we need to continue with the conservative treatments.
Yeah.
It's not like surgery is the end all cure all. Hey, once you have surgery, da-da, life is perfect.
Yeah.
We have to always care for ourselves. And so that's why at Lipedema Simplified, we are always going to talk about the conservative treatment that we can do for ourselves starting before we go to bed tonight,
Yeah.
possibly. Whether it's whether it's walking in a pool, or taking a cool bath and doing some massage and taking good care of our skin. We can start tonight
That's right.
by doing something for our lipedema and to take good care of ourselves. So I am going to put in the chat, the comments. Let's see if I can do this without too much struggle. This is one company. It copied everything. Um, Sorry about that, you guys. I ended up with a lot of stuff on my. Okay. Um, so I'm going to put in the chat the 80s information. And Eros Medical, that's one of the pumps that she suggested. The other ones, Lymphopress and Medi Brios. Let me get those in there also.
And
Go ahead.
one of our folks here pointed out that if you're having a problem with a pump that you own, generally they will send a representative to help you with that. So the person who's having a problem with tactile, you should have a tactile representative who can come assist you and try to make that machine easier for you to use. I have had people tell me that they have had machines of varying brands that they could never come to terms with, and that a different brand worked better for them. We are all individuals and we all have preferences, and I don't think there's any shame in that. The only downside is that your insurance company may not buy you another one in a 5-year period, so you might be
Right.
in pocket.
Yeah. And see, and that was the other thing. I was in the process of getting a pump, or so I thought. And then when we got done with all of the work and everything, my out of pocket was $2,800. And I was like, I, I, I can't do that today. You
Well,
know, I couldn't
buy
do it.
you can buy the arrows for a great deal less than that and pay cash for it. So, I
Right,
don't know the price points on other pumps. I know ours because I've sold them to a couple people who didn't want to deal with insurance. Can be obtained for a great deal less than what you're commenting. And I don't want to throw prices out right now without having
right,
spoken to my manager and making sure I'm in the right zone,
right.
but
And
a lot
yeah,
less than your.
right. And that's okay because I thought that my insurance was going to cover it, and so I was all thrilled, right? And because of my insurance pretty much covered 50% because the pump that I was going for was not in their category. If I would have selected a different pump, my my copay would have been less.
Right.
But $2,800, even though the company would have happily given me a 5-year payment plan, I still couldn't justify. I couldn't look at my husband and say, "Hey, I'm going to start with a $50 a month payment for 5 years." I just couldn't do it. You know that
Mm.
I probably should have, but I just couldn't justify it. So that's when I learned how to dry brush because I'm like, okay, I gotta do something else. Well, in the meantime, or maybe what I really need to do is go to the gym and walk in the pool for an hour a day. But I was just like, doggone it, it was just too much. And yet, really, is $50 a month too much for me to take good care of myself? Probably not. But at the time, I couldn't justify it. So I think we all have to come to terms with how much is my care going to cost me.
That's right. And what, how beneficial to my quality of life is this item going to be? Is it worth it? And you may say yes and you may say no, but the different brands are all going to be at different price points, and there's going to be different reasons why a certain model is better for you. And I mean model within a brand or model across brands. So it's worthwhile to talk to either somebody like me who knows a lot about different pumps and stuff, or to your own CLT, which would be preferable. But I'm here virtually for people who don't have access to that. And
Right,
so
right,
Veronica can advise on that stuff. So we have a couple CLT coaches with Lipedema Simplified who can help with those kinds of decisions and planning and figuring out what's best for you.
right. So I want to tell everybody it's been fascinating, Adie, talking to you. And I would love everybody to go over and click on a heart. It looks like this. I think most of you guys know what a heart looks like. Or a thumbs up that looks like this. And let's see those thumbs up because I can see how many people have hit it. And we've only got two, and we've got 31 people watching us at this very moment.
Oh
And
my
don't
goodness.
forget, I know, 31, right? And here we are just having a chat. Don't forget, don't forget to, and Sheila, I have, if you look in up a bit, you will see that I put 80 at lipedema-simplified.org and her name, and it's called Eros Medical. That is the pump company that she works for. And look at that, we now have 10 thumbs up and hearts. See, all I gotta do is
Yay.
beg. Um, and so here is a question from Karen, and it's a big long question.
Yeah.
It says, I just had my knee replaced a week ago. I am not processing um, like therapy believes I. Oh, I'm not processing like therapy believes I should. Okay, progressing. I'm 72. and it seems that I have a lot of swelling. The knee just won't bend. Pain is unbearable. Doctor's office is okay with the progress, but not the therapy. I tried to explain that I have lipedema and the excess fluid is from that, but to no avail. Um, to no avail, no relief. Will the lipedema affect the after surgery? I have had a knee replacement, and I can tell you truthfully that um, it took me a while. Now you're only a week out of surgery. Um, it takes a while because what happens with a knee is our body wants to encapsulate that knee, and it's going to build like shoe leather as fast as it can around that knee. Plus, you've got fluid in there, probably from lipedema, maybe some lymphedema going on, just simply because of the fluid in there, and it is going to make that knee stiffer.
Post-surgical edema is a thing too. So, that's
Yes,
a normal part of healing after a knee replacement is to have edema, to have swelling. But you do want to get it down as soon as possible, and you might not be able to work directly on it just yet, but you can generally work those nodes in your groin, in your collar area right away. So
right.
um, that would be a nice conversation if there's a CLT handy.
Yeah. So you want to get that, you do want to get that swelling as low as you can get it so that you have more flexibility in that knee because you're going to need to be able to do the physical therapy. And I promise you need to have that you need to do physical therapy. With a knee replacement, with any joint replacement like that, physical therapy is key to your progress. Now, if your orthopedic surgeon says, yeah, you're doing great, and your physical therapist says, no, you're not, maybe they need to discuss what your orthopedic surgeon is expecting and have your physical therapist work closely with your orthopedic surgeon
Yeah. Yep.
because they need to be on the same page for you. They don't need to be causing any more stress and chaos in your life.
Yeah.
So they do need to be on the same page.
And it's, a week is really, really soon, even though you want to start seeing things happen by then. But a week is not very long after a major surgery. So,
No.
I suspect things will start to speed up in your recuperation.
And ice can be your best friend sometimes after a surgery like that. And so, what is it called? Rest, ice,
Rest, ice,
uh,
compression, and
compression,
elevation.
elevation. you know, your body has been through a tremendous ordeal, and you have to honor it. Um, and so many people. I mean, I had my knee replaced when I was 46. So, and even then, I still 15-ish, 15 plus years later, my knee still gets stiff. And it's because I, I have to continue to break down that scar tissue. It's going to continue to build around that. So Karen, keep us posted on how you're doing with your knee replacement. Okay, let's see. There are a few things, Adie, that
Yeah.
I want to talk about because I do need to talk to the community about something that's coming up this week. So first of all, Catherine and I are going to be teaching what we call a CSIG here at Lipedema Simplified. A CSIG is a coaching special interest group. And Adie, you're actually going to be um, one of our guest speakers on
Yeah.
that.
Yeah.
It starts Monday the 17th, and it's going to go for 4 weeks. It's going to be on Mondays, and then we're going to have a special check-in on Friday. So we're having two visits a week, and Adie is actually going to be one of our guest speakers. It's called Living Well with Lipedema, and I'm putting the registration link in the comments right now. So if you're interested in taking a more intensive course from Lipedema Simplified, I have their registration page for the CSIG, and we that was CSIG, Coaching Special Interest Group. So check that out. And then the other thing that we're going to have coming up this week is a pain clinic. And this is with our very own Brian Hayward. He is a CBD specialist, consultant, and he can talk to you about maybe managing some of your pain through taking CBD. And he teaches us about um, how to select CBD, which product might be the best for you to use, how to find a good product, even if it isn't from him. Like we know that he doesn't ship into Canada, and so he helps people take a look at the CBD that they find on the shelf and to tell if it's a good CBD. He can tell you why CBD works. Anyway, the pain clinic is going to be on Friday at 1:30 p.m. Eastern. 1:30 p.m. Eastern. And so I host that with Brian. And there's a registration in there. That is a free clinic. The Coaching Special Interest Group is actually a course, and there is a fee for that. Um, there is a question in here that I wanted to ask for you. Cindy asks, does your company come to Canada or ship to Canada?
So the answer is yes and no. We are not approved in Canada. We have an FDA here in the United States, and we are not approved by the equivalent governing body in Canada. Some people from Canada have come to the US and purchased our products and taken them over the border. So they'll work there. I don't know if you need a converter on the little plug or not, but I know that people are using them in Canada, but they're not going to be available through the National Health Service or another medical service in Canada because we don't have that equivalent FDA approval.
Okay. Okay, thank you for clarifying all of that. So, with that said, Adie, we have been on this call for about 43 minutes, and which is so me, it's always like 30 minutes over, because you never
Oh,
know with me.
well,
Yeah, we usually go a good half hour to an hour. And I just want to thank you so much for spending some time with us today. If there was one message that you would like to share with the community that you would love to see echoed around the world, what would it be?
I think just take the time to do the things that show you that you love yourself and express your love to yourself. Because if we don't start with number one, we don't do very well with others.
That's wonderful. And I want to say, please, ladies, gentlemen, whoever's watching and listening tonight or in the replays, reach out to Adie. She's brilliant. She has so much information to share, compassion, and her heart is huge. And just remember, you are not alone. We're here with you. Um, and the community is here. And also remember that there's hope. There is hope, and we're here for you. With that, have a wonderful